Hello, this is day 5 of the Tiny Feet Big Steps conference in beautiful Arusha, and I have yet another incredible person to speak with here. Hi.
Hello.
How are you?
I'm fine.
All right. So, what brings you to Arusha? And could you tell us a bit about your background?
So I am a neonatologist. I'm from the University of Vermont, United States, and I actually got into medicine originally because I wanted to do global health work.
Okay.
So I've always known that that would be some part of my practice. And as I've become a neonatologist, I've become involved in research and research projects and educational initiatives that are centered around global health and really trying to reduce neonatal mortality in LMIC, low middle income countries.
Is it your first time at this conference?
It is. It's my first time in Tanzania.
Ooh, that's exciting.
It's beautiful.
It is, honestly. How did you get to know about the conference?
So I am part of a working group of physicians from a few different countries. We are working together to try to assess kind of the state of point of care ultrasound use in caring for neonates in sub-Saharan Africa. And as a part of that work, we're looking at opportunities to provide more education and training and to work with companies to provide advocacy to try to get more affordable equipment. But as a part of that, I was connected through somebody in that group with Steve, Dr. Swanson, and I was told that there would be a point of care ultrasound or POCUS workshop at this conference. And I was asked if I would want to come help teach at it. And then kind of as things happened, I was asked if I would like to lead it. So that's how I'm here.
Okay, and how has it been leading the POCUS training sessions here?
It's been fantastic. There was so much enthusiasm. I would say there were more than twice as many people who wanted to take the workshop as we were able to accommodate. And we did evaluations after we finished the workshops, and we asked everybody, what they thought, what we could do better for next year. And everyone said, this was great, but we just want more of it. We need longer sessions. We need, fewer people in each station, more instructors. So I think it's nice to be a part of something that's been so well received and that everyone's so enthusiastic about.
Is this the first time you're training in POCUS sessions in the African continent, or have you done this before?
In the African continent, this is my first time.
Okay.
Yeah.
And where else have you trained?
So I work over in the United States, and I've been involved in some trainings over there at my home institution. I've gone and participated in trainings at Children's Hospital of Philadelphia. But the truth is that when it comes to POCUS, I'm the director at our center of POCUS, and I've been charged with kind of training everyone and bringing that curriculum. But compared to some of the other instructors who were here, I'm personally kind of a novice. Like, I'm also still just learning and getting better at different skills. So, while I had the privilege of kind of pulling everybody together and organizing how everything would work, there was lots of learning from me too, from the other instructors.
Wow, I love that sort of peer-to-peer learning. Learning never ends, and there's always something new to learn.
Always. And especially, I think, with POCUS, you can always get better and take your skills to another level if you want to.
Have you been involved in other conferences or trainings in Africa or the US?
Yeah, I've been involved in trainings. I've been involved in helping babies breathe trainings, both in the US and over here. I've done some of those in Uganda. Long time ago, when I was younger, I was involved in some educational work in South Sudan. But the majority of my global health work since going to medical school has been more research focused.
Okay, so what kind of research are you involved in?
I've been involved in some studies in Uganda looking at bringing ultrasound services to rural areas and the effect that has on outcomes for the pregnant women and for their babies, and also looking at, how does that affect referral patterns? How does that change the care that they receive if they're able to get an ultrasound before they deliver? And then I'm also currently working with a group of both Ethiopian and American doctors on a study in Ethiopia where we're looking at infection. And in particular, we're looking at resistant infections and kind of trying to get a sense of if patients are colonized with the bacteria that are causing those infections, and when during their hospitalization are they getting colonized. That work is ongoing.
Okay, and what type of research would you like to be involved in going forward?
Oh, that's a great question. I mean, I like the things that I'm doing. I would say in the infectious disease work, is probably not something I'm going to continue to pursue. The ultrasound work does feel more exciting to me. It's kind of more where my passion lies. So I'm hoping in the near future to be doing a lot more with POCUS and studying how it's being used, how is it helping, in order to improve access, in order to be able to provide more trainings, provide education, and like I said, work with companies and physicians here in Africa to try to get them the supplies that they need.
Linking back to working with physicians in Africa, I know you're part of the Vermont-Oxford network.
Yes.
Could you tell us more about that?
Yeah, so I am a volunteer in the global health section of the Vermont-Oxford network. And the Vermont-Oxford network, broadly, the concept is, collect data on what you're doing so you can measure how you're doing, and then compare that with other institutions that are similar to yours, other hospitals, and learn from each other. So if there's one hospital that's doing something really well, they're doing bubble CPAP really well, another hospital can start collecting data on how their bubble CPAP is working and compare and maybe learn from that other hospital about, quality improvement work that they could do to improve their own CPAP. So that's the Vermont-Oxford Network mission. And the global health work that I do with them as a volunteer is mostly educational, working with their masters in neonatal nursing students in Ethiopia, working with neonatology fellows that they have helped to support through education, both in Ethiopia and Rwanda. And I've actually partnered with Vermont-Oxford Network member hospitals in Ethiopia to do the infectious disease work. And then actually a lot of the folks who I'm doing global health point of care ultrasound work with are people who I met through Vermont-Oxford Network.
Oh, wow.
And then, yeah, it's a small world.
The neonatal world seems to be quite
Especially neonatal global health. It's like the same names and faces keep coming up, but it's wonderful.
But the same names and faces doing incredible work. It's great to hear how you're linking through different networks as well, because I think that's what Africa needs to peer-to-peer learn, global south to global south collaborations and learnings, because that's how we learn best. There's a lot to learn from the global north, but there's so much more to learn just amongst each other within our circles as the global south, as the African continent. So it's great that the Vermont-Oxford network also amplifies that message.
Yeah. I think you're absolutely right. And yes, that is, they're not having hospitals in Ethiopia learn from or compare themselves to our hospital in Vermont. They're having them learn from and compare themselves to other hospitals of Ethiopia or hospitals in Rwanda so that everyone can help each other and can learn from each other.
That's brilliant. So being part of this conference, back to the conference, do you think you'll be coming back here again? And also, what are your hopes for this conference as a first-time attendee and speaker?
I think it's a fabulous conference. I think it's so wonderful to be at a conference that is attended by people from more than 20 different African countries. I mean, the physicians and nurses here are, representing broadly almost this entire continent. And it's really wonderful to have all those healthcare providers together in the same room, in the same conference hall. And I feel like I have learned just as much from all the attendees as I think they would say they've learned from any of the speakers. It's really been brilliant that way. I think in terms of hopes for the future, I would love to come back. I would love to keep learning from this conference and participating. The reception that we got for was that people really want more of that. So I'm hopeful that next year we can provide a larger training where we can include more of the attendees and have more time for small group hands-on practice, because I think that's really what a lot of people need. And I hope that when I come back next year, depending on where the technology goes and how well our advocacy efforts work, that we're able to offer some more affordable handheld ultrasound devices that are, cost affordable in this setting and that people can actually afford to purchase to use in their unit or use in their personal practice. Because right now for neonates, the options in terms of point of care ultrasound that's affordable are really limited, but the demand absolutely is there. There are so many physicians who want to use it at the bedside. And if I were to get on my soapbox for a minute, I would say that I think point of care ultrasound is really an important tool in caring for neonates. It can actually answer questions that you can't answer, even in my high resource setting, with the gold standard equipment that we're using currently. There are just things that X-ray and lab work and exam won't give you a complete answer all the time, and certainly not maybe right away in a very sick baby. in the middle of the night, or, you know, when you're waiting for the x-ray machine to come up. And all of that is amplified here. There are many babies that don't have access to x-ray ever, or if they do, they might have to wait a day, and they don't have access necessarily to, you know, extensive laboratory investigations and other things. And so having the ability to make, you know, quick decisions about yes, no questions at the bedside, I think is really, really important.
Thank you for sharing that. Thank you for your insight. Thank you for just being here and pouring into doctors that are hungry to learn, and nurses, and just everyone learning from each other. It's been a lovely time speaking with you. And yeah, sad to see this conference end, but hopefully it continues in our little pockets wherever we are all over the world.
I hope so. I hope we all stay in touch and keep working together until next year.
Yes. Thank you.
Thank you.
Bye.